Good afternoon, everyone. Welcome to our AIHEC webinar. We are going to get started. Here's some resources. Make sure to take care of yourself. Today's topic is particularly sensitive for some folks, so we encourage you to make sure to practice self-care. But our speaker today is Sam Rivera. He has 31 years of progressive experience in social services. His primary focus of expertise lies in criminal justice and reentry, HIV/AIDS, harm reduction, addiction, recovery, and mental health. He currently serves as the executive director of OnPoint NYC, a long-standing harm reduction organization that provides services to active drug users and sex workers in northern Manhattan and the South Bronx, many of whom are low income or homeless, as well as people of color and LGBTQ. As an Afro-Taino, he brings to his role several decades of cutting-edge service provision experience and a commitment to social justice. He has dedicated his professional career to ameliorating the harms associated with the war on drug users, racism, sexism, structural inequality, and mass incarceration, and will continue to work to end systemic as well as systematic barriers to populations that are most vulnerable. Due to his dedication to this work, Sam Rivera was recently recognized as one of Time Magazine's 100 most influential people of 2023. So I'm going to pass it over to our speaker today, Mr. Sam Rivera.
Hahom, for this opportunity. Thank you for this opportunity. It's a pleasure to be here. Dhaka, Sam Rivera. I am Sam Rivera from the Taino people from Caribbean. Also the island of Puerto Rico. People know it as Puerto Rico. We know it as Borinquen. And yeah, it's really a pleasure to share the space with you. I'm hoping many of you will join and I can see your faces because in our native way, it would be good. You know, we really prefer to do these things in person because that energy is really powerful and important. And part of what I want to do today in following that is to speak only for a little while and then have a dialogue. I find that to be a more a healthier way, a more indigenous way of doing things. You know, I think about when I was younger and I had difficulties in classroom. And I find out later on by elders, like just the didactic situation made me uncomfortable. I didn't understand why, right? We learn in circle, everybody gets to speak. There's not a person in the front telling us everything, but there's a way we work in this energy that's very different. So I'm working very hard to try to get people to do fewer PowerPoints and more discussion and give the audience an opportunity to speak as well. And you'll notice when you go to conferences or something like that, as soon as, well, if they open a microphone and people have questions, one of the first things they do is actually present. They don't really ask a question. They start talking so much because they had so much to say throughout. So I like to potentially avoid that and have a discussion as we go through this conversation, less about a presentation, but more about a conversation. Sorry, it's asking for an update. Yeah, I'm excited to be here, and I'll start off by, you know, talking about the work I've been doing for many years now, and sort of how I got to where I am now, and coming back to harm reduction. And also talking about harm reduction and what it is. A lot of people are very confused about harm reduction. There are a lot of opinions about harm reduction, most of them not the best. So I want to talk about that too. And I'm hoping, or I'm believing that when we open the floor for conversation, that people will be very direct and honest and ask those tougher questions or even share concerns or thoughts, what have you, about this process. So now almost 4 years ago, I was working primarily working with people reentering out of prison, and people also exiting treatment programs, et cetera. And I get this recruiter calls me and says, you know, we really want you to consider this position at these two organizations that are trying to merge, et cetera. in harm reduction. And I was like, no way, I'm not going back to harm reduction. And that initial response was about my frustration in knowing that we were so many years into harm reduction, and for me, in my opinion, we were still showing up in this way where we just fought for everything. Everything was a fight. Everything was a fight. And I didn't want to move in that energy anymore. Simultaneously, I was being told by my elders that I was a bad warrior. And I didn't understand, because I said, what do you mean? I'm a great warrior. I'm always ready to fight. And they said, that's the problem. That's not a warrior. A warrior does everything possible to avoid fighting. It does everything possible to move in a different energy and get to that space. And then if fighting is there, we're always, open to that and available to fight, but don't show up fighting first. So this was happening at the same time. And in our culture, many of our native cultures, this is not a coincidence, right? We know that we're not in charge. We follow the leadership of our elders, of Mother Earth, and all the other blessings, right? Father Sky, and things that come to us, which is why many of us also say, watch what you ask for, because you might receive it. And so I was trying to do everything possible not to get the job, right? So I went in to talk to the team, and I'm like, oh God, what am I doing? And my first day there, the team responded to an overdose, and it was in a beautiful moment. And they did it like it was just part of a day, everyday part of their job, like making a copy on a copy machine. And that touched me. And I left the meeting, and I told a really good friend of mine, Jill, I said, I'm not going to work there. I don't want to do it. The place is a mess. They have a lot of things I have to fix. It's just, I'm not doing it. And she turned around and definitely spoke from another place and said, no, that's why you're supposed to go. You're supposed to go and kind of fix all that. And so, I looked at it more of a challenge, but I was excited too about if it does well, I don't really need the credit, but if it fails, I'll take the blame, right? Like, let's maybe get into this. And then I said to the team and other people I knew in harm reduction, I'm coming back to harm reduction, and I'm not going to continue this ongoing constant fighting, but I want to move in a different energy and make it inclusive and talk to people and have a relationship with our funders that's a relationship, not yelling at them for more money, but justifying why more money is important. Talking about changing the landscape of the work we do. Like, why do we do it this way? Coming in with this indigenous part of me, which I almost never brought to work, because I was taught by these white institutions and these other places that move differently. And most of it, if we look at it, is punitive, right? And I think about our indigenous culture. I was just at Gathering of Nations, so I'm coming with extra energy right now. But and I think about, I was with a friend of mine trying to educate him on things, and he says, you guys don't have words for goodbye. You guys don't have words, right? Because we don't end things. We always talk about seeing you again and visiting again. And it's all about moving in this positive way as much as possible. And so I told people I'm coming in with love, and they were like, oh God, what is this, love thing? But it was really because of my mom. And I try to hold on. My mom just passed, so I'm really trying to hold strong. My mom was a nurse for 42 years in New York City, in a New York City hospital, and on the Lower East Side where I grew up. And when I was younger, I was really the epitome of a mama's boy. So I went to her job all the time. And at the time, the Lower East Side was the heart, the center of drug use, then. And I went to visit her, and I would go visit her all the time. And there was this one time where she was working with a patient, and I saw him there all the time. And I said to her, I said, Mom, you keep helping this guy, and he doesn't want your help. Like, he doesn't deserve it. He's always here every day. And she said, my job as a nurse is to work with him until he's able to do it for himself. Like, that's my role. And it gave me this thing that in my work, what I've been doing all these years, because I've been doing the same thing, is loving on people until they're ready to love on themselves. And that's always reminded me of when I show up to a reservation, or when I show up to folks who move in that very specific energy. And so it was coming to me at the same time while I came to the organization. So I came to the organization, as I said, almost 4 years ago. We were two organizations trying to merge. We were homeless in one of our sites up in Washington Heights. Things were rough. We had a quarter of a building in East Harlem. Just, it was pretty scary and pretty intense. And so I'll just fast forward, not really about me, because I think what I brought to the team, amazing staff, is the supportive way I always wanted to be treated, and the way I was treated in Indian country. And I fast forward this way. 4 years ago, we were 56 staff members, $6 million. A week after I took the job, I realized we should have been 7 million, so that was very scary. 6 million might sound like a lot. In New York, it's with this kind of staffing, it really isn't. And what we're trying to do, it really isn't. So I fast forward to today, where we're $18 million organization with 162 staff. Again, I'm not saying I did that. I will speak for mom and say I will say some of my approach and what I learned from my people, and my culture allow for this to flourish in that way. The relationships with funders changed, the relationship with police changed, the relationships we had, in the work. And that's something I'm pretty proud of. And one thing I said right before the call is, for the rest of time, the first person to open, that led the organization that opened the first 2 overdose prevention centers, OPCs, in the country, will always be indigenous, and they can't take that from us. And that's something we want to look at too, right? Is to continue to own what's ours, is to reclaim what's ours. So in reclaiming, I'll share something else. Harm reduction, where did it come from? Because people are very confused. So you heard I was in this work now 32 years. I was like 10 and a half when I started, so don't judge me. I'm not that old. When I first started this work, I was working in HIV, and we started to provide harm reduction services without even knowing it, really. So I would work during the day, go home, I was married at the time, my wife and my daughter, and then get back up and go to what we called back then shooting galleries, where people were injecting drugs and buildings and what have you. And me and a bunch of other friends of mine, I was a member of ACT UP, which completely changed my life and really taught me a lot. It was the epitome of an eclectic group of people caring about so many different people. It was a beautiful experience, something that's always impacted me. I still have my original ACT UP shirt, doesn't fit, but I have a new one that fits a little better. But so what we would do is like go out, clean syringes in a bucket with bleach to make sure people didn't transmit HIV and other diseases. And that was going on. It was going on in New York and Chicago and San Francisco and other areas. And we didn't realize we were all starting this thing called harm reduction. And what made it so different is we didn't tell people what we believed they needed. Like, you need to stop. We told people, what do you need? We asked, what do you need? And what do we do to support you? Did we want them to stop? Of course. Most times we're like, please, right? We see people creating this harm, but reducing the harm is the beginning, right? So I often give people, if we were in person and we had coffee available, some of you might use Splenda, harm reduction, right? Some of you might use oat milk, because I have in here, harm reduction, right? Harm still exists. The caffeine may not be the greatest. Let's try maybe decaf, right? To understand what that means. Harm exists. What do we do about it, right? So coming back into the work in this way, early on, starting to have conversations about the possibility of opening an overdose prevention center was pretty intense, because even my own personal experience, when I first saw a overdose prevention center, I thought it was outrageous. I'm like, this is nuts. People are coming into your site and using drugs. Like, what is that? Are you crazy? But you learn more and more that in any work with humans, we can't continue to tell them what they need. We need to be available. And I often say our participants allow us to work with them. Our participants are these beautiful people in pain, right? We talk about why people use, what's at the core of their drug use. For our people, then this isn't a party. They're not coming in and going, oh, I need to get high. And those of you who've been around this work or have family members or what have you will tell you that they're in pain. I'm hurting right now. I need something because I'm in pain. I need this. So we know that they're self-medicating pain, traumatic experiences, mental health conditions, etc. And in addition to that, women have been a lot stronger than men in talking about their trauma and owning that experience and wanting to work through that, where men don't. And me as a big tough guy, being open and talking about my trauma, I didn't realize that was another thing, that my ancestors told me I need to talk about, be more public about, is like, why did I do things in my life and put myself at risk as a person with lived experience to possibly die? Because there was a time in my life where I went through traumatic experiences and I didn't know that. I didn't understand. Overall, I was a pretty good kid and I did really well. But why did I continuously find myself in these situations? Is because when I was a kid and I was in a situation where I couldn't defend myself, for the rest of my life, internally, I felt like I always had to defend myself and no one would ever get in there again. And right, I'm going to protect this. So I would do other things to harm myself out of anger for not being able to defend myself when I needed it. And so as much as we're able to talk about that openly and support people who are going through this experience, through a variety of experiences and trauma, it really has an impact. Creating that safety, creating that place for people to feel comfortable enough to be vulnerable is very different. And we know that is something, again, culturally, that also is also very different. So it's a blessing to do that. I look at my own identity in this work or in how I show up. I'm in New York City, where one of the most frustrating things is how many Tainos are in the city and don't identify with it at all. They don't even know they're indigenous. We've been told that we're from Puerto Rico and we're American and all these other things. We were the kind people who met Columbus first. We were the kind people who welcomed in onto our land, who ended up doing what he did to our people. And so it's important for us to also not have the cultural denial, but actually embrace who we are as indigenous folks. So I mentioned before, like, why do people use and what is that about, right? When I talk to people who are actively using and say, why do you use? Oftentimes they say, I'm a bad person, I'm lazy, all the things they've been told, right? I'm all of these negative things. Why do you eat so much? Oh, I'm so lazy. Why don't you work out? Whatever it is, right? For you to understand that we've been taught to identify with the worst thing we've ever done. And I remember my mentor, David Rothenberg, arguing with a reporter who wanted to meet with me. And the reporter said, I want to know what he went to prison for. I want to know the thing he did that was really wrong. And we're sitting in this meeting and David says, what was the worst thing you've done? Like when you were a kid, were you a bedwetter? Because if you were, I'd like the article to say, this is about Sam Rivera, who's done this. And then I want the art. And he said, I want the author to be author so-and-so, former bedwetter, right? Like if we're going to constantly identify with the worst thing we've ever been or what we've done. So for instance, my prison experience, my crime is not who I am. It's something I did. It's no longer who I am. It's not who I am. It's a part of it, right? So if we're going to talk about ourselves, to talk about yourself and all these other things you are too, all these beautiful things you are. So when I talk about, and when we talk about our participants, we talk about mothers and brothers and fathers and uncles and nieces, beautiful people who are in pain, beautiful people with the right support and opportunities can and will change, right? And we know that. We know that in this work, when you find people who've had these lived experiences and they start to shift and change their lives, they become some of the most powerful people out there, some of the most successful people out there, because they know the pain and they know the struggle of walking through this work. So I want to briefly talk about the OPC, Overdose Prevention Center, not injection site. It's not that. It's an OPC because it's polymodality. People use any drug they bring into the facility or into the room. I want to be careful with facility. The perception is when you enter our building, you open the door and it's just a bunch of people using drugs. Like it's some party. It's not that at all. It's a structured environment. In fact, when you come in our building, you walk into a drop-in center, people having coffee, people are on a computer, people watching a movie. There's all of that going on. The OPC is one program within all these programs. I'm going to ask Veronica to share this image to also look at understanding why and how I view and how many people in harm reduction view how people, if they want, because it's their choice, want to reduce their use or end their use, how people get there. It's not by forcing someone to go to treatment. It's not by forcing, by scaring them with punitive, alternatives, right? If you don't do this, then you're going to get this thing. Everything's punitive. And then people think it's a successful outcome, right? If any one of us is facing 6 years in prison and they tell you go to this 1-year program, you're going to the 1-year program. And then you come out and they go, wow, I'm looking at David. I'll pick David. Oh, you're great, David. Good job. And you're like, well, I was forced to go. I don't know if it's really a good job. So I want you to take a quick look at this, right? Because there's also this, I mean, just imagine this place. Try to walk you into it. And in fact, we are creating a virtual tour. We'll share that as soon as we get it done. But if you're ever in New York City, definitely reach out. We'd love for you to take a tour of this, we have 2 programs, 2 buildings, sorry. So in the middle, this is our logo, right? So it's the colors of our people. And you know, if you look at a medicine wheel, very similar. So yes, I brought that to the organization. And we look at this and say, all right, so we have Overdose Prevention Center at the center because that's what most people want to talk about. And it's important to look at all of these things that happen around it. Look at all of this, right? So we have a volunteer program, we have mental health services, we have the drop-in center I mentioned, syringe services, laundry services. And they're called laundry services because we wash the clothes for the people. They don't come in and use it, we wash for them. We have low threshold medical, public safety, safety and outreach program that goes into the community, goes to places where we know there are syringes, or people might be in a park, or people are in an encampment. Our team goes out there and meets people where they're at. We know that harm reduction is the epitome of meeting people. We have showers. We don't shower them. They shower themselves. We would do the laundry. And when we look at our respite program as an example, someone comes in and they say, I really need to take a nap. We tell them, all right, take a shower, give us your clothes, we'll wash your clothes. We give them fresh clothing when they finish the shower. And then they go into this room. And we have these cots set up with aromatherapy, with staff members in the room, and they get to take a really safe, very safe and comfortable nap. We know factually, homeless women in the street will be seen taking a nap during the day in like a park bench because it's safe. And that's sad that this woman has to sleep during the day in public so people can watch her, make sure she's safe. Coming into our program, they could sleep safely. We also have this thing, Kaylin C., our senior director of programs, will say, you know, if couples are in shelter, when they go to shelter, they have to go to separate shelters, right? So if they come to our respite room, we'll allow them, we'll put the cots together and they can at least throw a leg over. No cuddling, but they can at least get some physical contact and feel comfortable in that moment. So yeah, we're opening a pharmacy very soon. We're really excited about that. We know that our people, when they go to pharmacy, they're treated very differently. They're asked to wait outside. So we want to avoid all that. Our pharmacy will also deliver medication, and the organization will hold medication for people who have no home. At the same time as we allow all of our participants to use our address for mail, et cetera. So we have medication adherence. I mentioned we have a holistic health program, which is absolutely amazing, where we have students from acupuncture school basically doing their residency with us. So you're coming in and getting full body acupuncture, aromatherapy, sound therapy. We're in the process of having a contract, very similar contract with a massage school. We know touch is very important and very important for healing. We're opening a salon and a barbershop. We're looking at so what we do in the organization as well is have a gaps analysis. What's missing? We ask the participants, what's missing? What would really, something we can actually do, right? And then we have case management. The thing I wanted to end on.
I'm guessing.
We good? Somebody? Okay. The thing I wanted to end on is in this piece is we look at the holistic approach. This to me is indigenous. This, we think about the whole person. And I think about food. And one of the most frustrating things I've experienced in my work of 30 plus years is you go to a place and if you get there, let's say at 1 p.m. and they'll say, sorry, you missed lunch. You have to wait till dinner. That's never going to happen to you on a reservation. It's never going to happen to you in a village in Africa. It's never going to happen in Borinquen, known as Puerto Rico. Never. When I get to my aunt's house and when I visit the island It doesn't matter what time it is. There's going to be food and there's going to be welcoming and it's going to be, right? So for us, it's the same thing. Yes, we have times for the meals, but if you walk in and you're hungry, you get fed. And this is the kind of stuff I would like us to really reteach and reclaim all of these programs out there. They don't see that preventing someone from eating who missed the meal time is punitive. It's not loving and healthy, it's punitive, right? And again, if our work is going to be about meeting people where they're at, people love to say that and love to say that, but there are all these other restrictions, then we're not really doing it. And food is love, right? Food is healing, and denying that is something that we do everything possible to avoid. I'm trying to. How are we doing with time? I don't see the time. Oh, we're doing good. Okay, because I really want to have a conversation as well. The other thing is to look at what you could take it down now, and if you guys want to share it, we could share it with you guys. Is more about identifying with what we have in common, right? Too many times we want to separate each other. What's different about us? But what do we have in common? What's really our goal in working with people? To understand that if anybody ever thinks, and I have this thing I used to say all the time when I was a case manager many years ago, I thought I was here to save the world and I was the best case manager ever. And I made a lot of mistakes because I believed that, because I was told that I can get people into treatment and they can do well, which is a lie, right? It's their journey. It's when they're ready. What we have to do is be ready to respond when they're ready. We've had people come into our program at the booth, like literally just used, and go, I need detox. This is it. And that moment, we have to be ready to connect them to detox, and we do. I think about our success in a variety of ways. We have these big mirrors in our booths when you come in. When we first opened, women especially didn't want to look at themselves. They hated the mirrors. They put things in the way. They just hated them. I cried many times in our office. And the first time was I came in the room and I saw this woman who was just amazing, looking at the mirror she hated to look at, putting makeup on in the same mirror. The relationship with self. That's beauty. That's healing. That's the beginning for her, the beginning of I'm going to change. Seeing a doctor for the first time and not being embarrassed. When I have people run up to me and go, look, I have my own doctor and I have my own PCP. I don't use the emergency room as my doctor. I'm seeing a GYN regularly. I'm going to the dentist. I'm doing like all of those things. For many of us seem like it's just part of life. It isn't for many people. And you have to celebrate those moments with them, right? And I try not, I always get emotional, but it's a beautiful thing. Since we opened, we've had over 1,500 overdoses in our space, all of which have been intervened, all with 0 deaths, maintaining what's been going on in overdose prevention centers around the world. I will say we want to be careful with the 0 death celebration all the time, because that's a hard number to live up to, right? So one day we're going to have somebody will have 1 death. And, oh my God, you failed. Can you imagine if 1 is a failure? But we will celebrate the fact that it's still at 0. And what we know is people don't have to die of an overdose ever again. It's just a fact. There's no debating it. 1,500 overdoses. Our approach is very different. Thanks to our senior director of programs, who ran these in Canada before coming in. We have an oxygen protocol that keeps people healthy. We're only using naloxone 18% of the time. 1,500 overdoses, 18% of the time naloxone. We never use Narcan 4 milligram, unless there's a possibility where we'll have 5 overdoses at the same time. Then we have to move differently, right? Of those 1,500 overdose interventions, we called 911 100 times, and not to support us with the overdose, but to address a possibility of something else going on with the participant. And I use those numbers for a very specific reason. So now I'll go back to this. We have over 5,000 registered participants within both OPCs. 136,000 times they have utilized our space. What does that mean? 136,000 times people would have used in the community. The community that doesn't want them, the res that doesn't want it, we don't want them here. So I used to tell the community, and they got upset. I said, wait a minute, I responded to your request. And they go, I didn't make a request. I said, but you did. You didn't want public drug use. You didn't want paraphernalia in the street. We agree with these, by the way. You didn't want your kids seeing people using drugs. You didn't want your family exposed to this. You didn't want all these things. We addressed it by bringing them in. And if you still have a problem with our people, then it's not about drug use. Right? It's about something else very differently. There's no war. There's no drug war in this country. There isn't. There's a war on drug users. There's not a drug war in this country. This country benefits from the drugs coming into this country. It's modern day slavery. This country, through its drug, through the process of drugs entering the country, serves its prison system, serves its hospitalization, serves big pharma by creating more and more people in pain who need medication, and you could fill in the gaps from there. So there's no war in this. There's no drug war in this country as it's presented. Specific drugs are allowed to enter specific neighborhoods. And when those people use and sell those drugs, they're punished for doing so. And it's not far reaching to think about what that looks like, right? And so, again, 136,000 times we remove people from using in the community, creating a safer community. In New York City, it costs roughly about $30,000 to respond to an overdose in the community. 30,000, right? Police, fire department, ambulance. They have a thing called the fentanyl task force, right? Blah, 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 blah. The time they have to spend in an emergency room. If you respond to an overdose the way you do in the street, the person has to stay in medical supervision for at least 3 hours. Those 3 hours cost money. Every hour costs. If there are other things going on with them, it costs. So on average, $30,000 an overdose. All of you have smartphones. 30,000, we remove 100, right? We call 911 100 times. 30,000 times 1,400. That's what we saved 2 neighborhoods in 2.5 years. Millions and millions of dollars. It costs to open an OPC and run it 24 hours a day about $2.5 million. So if it costs, and we're not at 24 hours yet, if 2 of our sites were 24 hours a day, 7 days a week, it would cost $5 million. Look at what we saved, just two neighborhoods in New York City in 2.5 years. Pays for itself and more. And sometimes this is the conversation you have to have with people for them to go, wait a minute, they don't care about the people, but millions of dollars, that might help. To receive accolades from emergency rooms close to our office, ask the staff to celebrate that because it's their work. I'm not in those rooms, man. I'm leading the organization, but our staff is beyond amazing, beyond amazing. I'm not in those rooms. I'm not in the parks doing that work. So I always have to acknowledge our people for what they do and how they do it. I also say OnPoint itself did not open the first 2 OPCs. Everyone we've ever lost to an overdose who didn't have to die. Everyone who's ever used a drug, everyone who's been working in harm reduction, everyone living with HIV, many, many, many people have sacrificed for us to get to where we are today. So it's a blessing that OnPoint did it. It's a blessing that my name's attached to it. But I'm very well aware that this has been a long race with a lot of baton passing. We just happen to be the ones who were ready at that time. We've also collected both within our outreach and public safety program and within the program, 2.5 million units of hazardous waste that came off of the street. 2.5 million units of hazardous waste. So when people I've been on calls like this, or I've been on presentations where someone wants to debate, then after I give all of this, they go, well, I think I better hold off. But if you want to debate, I'd be happy to. But yeah, looking at all of this, right, it's really about showing up in this very different way. I will say, if it wasn't for my indigenous upbringing, my elders shaking me many times and teaching me many things, staying as humble as possible, I think I would have made a lot of mistakes in this work. People said when we opened these 2 sites, that it was radical, and I realized that it's not radical; it's righteous. This is about loving people. This is about seeing people for who they are. This is about respecting their process and not demanding that they do things differently. It's just I'm blessed again to be able to do it. I'm blessed to be able to be chosen to do this, and I'm aware of that. And so, as indigenous folks and people who support our work and working with humans in the way we do, we really have to reclaim this and take it back and demand that sites like this are open. And by the way, there are different models. There's a hospital model. There's all kinds of models. For instance, And I'll wrap it up here. I think I'm trying to look. Oh, couple of very important things. But let's talk about models very quickly. There is a hospital-based model, because if you think about it, if you go to certain neighborhoods and you open OnPoint and you have this thing outside, people aren't walking in there because they're going to go, wait a minute. It reminds me of HIV days when we had these like pop-up clinics and people wouldn't walk in because people knew if you went in there, you likely had HIV. So a hospital-based model will allow people in maybe nicer neighborhoods to walk into a hospital and then find their way to that program and be able to use it. Whatever it takes. I'm not close to that at all. In rural areas, very different as well, right? There might be a mobile option. There are many options. My biggest thing is that you provide other services as well, giving people the opportunity to use and having access to food, nutrition, and wellness and all those other things. Couple of quick stories. And one big thing is one of our number one partners is the NYPD. I smile big on that because I could never imagine myself saying that, but it is truly an amazing relationship. We promised them their jobs would be different, and we proved it. They didn't have to arrest people the way they used to for having drugs in their possession. In fact, they walked the people over to our program and escort them in, which is a beautiful experience. They realized themselves that arresting people in that kind of pain really hurt them, even emotionally. Like, I can't believe I'm doing this again. And this person needs more than being arrested. In New York City, 4 out of the 5 district attorneys signed on to our work. Why is that important? It tells the police departments, if you go ahead and arrest these people, we're not going to prosecute because we support OnPoint and the OPCs. We want them to access that program. We want them to utilize that service to see what happens. A lot of people, and you might ask it here, a lot of people say, how many people did you send to treatment? It's interesting. Sometimes I wish I was in treatment because treatment doesn't have to do anything. They get all the free promotion. Everybody send them to treatment. And we could look at those numbers. You might not like them. How many people did you send to recovery? There's no thing called you don't send people to recovery, right? And recovery is individual. And I'll tell people, when you participate in some of these programs, and my brother's celebrating 30 years this year, so I want to be very clear. And he and I have real fun, agreeing and disagreeing. But when you have such strict programs, think about this. I've had many people, again, I've been in this work 3 decades, who I know are in AANA, whatever, right, with some of these processes, and cannot go back to their home group or whatever and talk about, I had a drink, because they would be viewed differently. We need to create safety for people. I used to have this program called the Third Way, which gave people that freedom to say, hey, if you go back to original days of drug treatment, a lot of you won't know this, it was about really cocaine and heroin. One of the things you got back within the first couple of months, you know what it was? Your drinking privileges. Can you imagine that? And when I tell people in the work, they're like, what are you talking about? It's a fact. You would earn your drinking privilege, because the thinking was the heroin, the cocaine was your drug of choice, the drug that really impacted you. Drinking wasn't so bad. So, I give people that just to think about the way it was created, and for many people it was successful. And one of my dear friends and former supervisors, who's, was in that first program, one of those first programs here in New York, has been home, hasn't used heroin again, but has been drinking for 40 something years, right? And we're not promoting any of that. I want to give you the full spectrum of what this could look like. I'll say this, please follow me on Twitter, Sam Rivera 1111. So at Sam Rivera 1111. I always forget to say that. If you find me on LinkedIn, please send that as well. And one other thing I'll say quickly is there's a park across the street from our Washington Heights site. My New York accent showing up again. And for years it's been closed because of drug use. And it was just closed. Beautiful little park, the children's playground. We opened November 2021. We opened this program, November 20. We've been around since 92. We opened this program November 2021. That summer, I walked all the staff to the window, trying to get emotional too. And I showed them across the street that park reopened. That's the impact of an OPC in a neighborhood. The park was closed for years because of drug use. Within months, from the winter of November to the summer of 2022, they reopened that park. And I asked the staff to celebrate that for themselves, because they did that. And the park would call us when some of our participants would go back in because they felt like it was their park. And we'd go and get them and bring them back into our building. So I think I'm going to stop there and open the floor and we can have a discussion. I talked longer than I thought I would, but yeah. So home, thank you in my language for giving me this opportunity. And again, I'm open to any question. You could disagree or we could learn some stuff. You could teach me some stuff. But again, thank you very much for this opportunity.
Sam, thank you so much for your presentation. You are doing remarkable work, and we're grateful for you for sharing out. I wanted to open it up for any questions, 2 different ways. You can put something in the chat, we'll read it out. If you want to come off mute, feel free to go ahead and do that. Kathy, I think you have your hand up. Is that right? Go ahead.
There were a couple of quick things. One, I wanted to first say thank you for doing this, and I really like the meeting people where they're at. I've created a lot of programs to prevent people from going down those paths.
Right.
But it's also, I'd love to chat with you individually sometime, if that's possible. I'm on LinkedIn. My last name's McAlpine. It's MC Alpine, and the first name's Kathy. But you know, part of it is how do you balance within yourself to, you know, sometimes you end up, because I work a lot with families and children, and sometimes the parents drive me crazy, you know, like the kid that wants to go into medical school and has a 3.9 GPA and happens to be bilingual, and we desperately need, and the mother says she's going to work at Target and she's going to work at Walmart and so, and I'm going, please, I will turn over rocks. So I want to know how you deal with that. And then there's one other quick thing I just want to say. I heard you said you're starting a pharmacy program, and one of the things I did at Denver Indian Health years ago, and it's now expanded, is recruited the university pharmacy students to come out and do rotations in underserved areas where they, because you're doing an underserved clinic, you don't.
Oh, she muted. Somebody muted her.
But you don't realize that you don't have time to, like, I recognize I was dealing with I'm a physician, I was dealing with a drug interaction. And so I had the students come out, and it's been running now 20-something years with the pharmacy, you know, PharmD from the university, but they could look at the different medications. A lot of our elders were on 10 to 12 meds. And so that's just something throughout, because you already said you have some students coming, but then help me figure out, how do you actually work with parents that don't get it, and then sometimes even for themselves, and you're sitting back going, please, you know, these kids, some of you have more sense than most of us out there doing something. How do you meet them where they're at and then gently guide? Because you can't always be everywhere forever.
Yeah. Thank you so much for that, Kathy. You know, one of the things I say is we're oppressed people. So, you know, when I graduated high school, it was like a party. Like I won some award. Everybody, graduated high school, life's great now. And I was like, and my white friends, you know, I grew up in the Lower East Side, I had different friends, were like, high school is nothing. Now we're going to college. I had no plan. I mean, thank God I played baseball and I was really good at it. So I got a scholarship. But, you know, that's what oppression does, right? We accept this. If you have a job at Target, that's kind of victorious, right? So getting our people to see that education doesn't belong to a culture. Education doesn't belong to any specific group, but it's ours as well, right? So that's a lot of what I talk to people about. I want them to sort of see why, what's at the core of you thinking that Target is the answer, or whatever, Walmart, like, at least you have a job. No, let's strive for more than that. And I grew up like that. You know, I grew up having enough was great. You know, if you think about religion, right? There's this religion, I won't get into it, but you know, if you have a cup of water and a piece of bread, you should be humble. And then I go to a different church and they're like, live in abundance. And I'm like, holy cow, I never heard this before. You know, live in abundance and be abundant and be happy, right? Not grateful is great. I'm grateful, but not to be so much that I limit myself from where I can get. And I grew up deeply in that. So we are, you know, a lot of it is to recognize that at the core of our people is oppression. you know, and it's hard for people to come through that and out of that. You know, we've been taught to be quiet. We've been taught to sit in the corner and not say a word. We don't go in the back of the bus or in the back of the classroom because we like it. It is impactful from our ancestors, et cetera. But that's really what I do, Kathy, a lot of times, is walk them through that. Unfortunately, most people will say, but if they become a doctor, they'll make a lot of money. Like that's not always the best motivation. But thank you for that. And I'd love to talk to you some more. Let's connect for sure.
Sam, Dr. Luger asked a question about, is there a formal mentorship program for people who have used your services in the past and are now in recovery? And also I will add that Dr. Luger, I'm sure would love to hear what you were mentioning to us before the webinar started about when you were trying to get the sweat lodges implemented at the prison system. So I know that's part of her work, is things like that. So first mentorship program, and then maybe you can touch on that too.
So it's sort of quasi formal, you know. What happens in our program, 80% of our staff roughly have lived experience. So some of that's mentoring just by showing up, right? So as myself, I was in prison. Interesting. I went to college very young. I played baseball, got hurt, came home, and then got involved in some organized crime and did these things. And this is what I was referring to before. Like, how does a good kid like me go ahead and want to put my life at risk? I didn't understand why. I go to therapy and the therapist says, I had a crush on this girl I worked with and she was going to therapy twice a week. And I'm like, shit, if she's going twice a week, I have to go like 4 times a week, right? And so I don't know if you notice, Black and brown people, we don't go to therapy because that's for crazy people. So I go to therapy, therapist says to me, why were you in prison? And I said, well, I was in trouble. I hung out with some bad people. I did some bad things. No, why were you in prison? Oh, 28 cops came to my house and took me. You know, I didn't know what she was asking. What led you to go to prison? What was your trauma? That this good kid, close to his mom, did really well, put his life at risk constantly. What is that? And that's when I learned about the abuse I suffered as a child, and when I couldn't defend myself, that it was my way of punishing myself for not being there for myself. Can you imagine that? So for me as well, people go, wow, this guy has that experience, that he's running this organization and he's on television or whatever it is, right? For people, that's a goal for them. And when I have participants say, I'm gonna take your job one day, I'm like, yeah, come get it.